So let's go through Miss Doris. Miss Doris is here. She's an established patient. She is here for her preventive medicine visit. He spells it out, the physician or she, as to why the patient is here. It's a 56-year-old female. She comes in today for a complete physical, her past medical history. She is 0 for a total abdominal hysterectomy. We can see she's had 2 deliveries. She's had a bunion repair. The only problem that Miss Doris is having is that she has headaches. And mainly in the morning, the headaches sometimes last all day, but they do get worse. They are worse in the morning. Her family history tells us that her dad died of a heart condition and her mom died of colon cancer. Her social history, she's been married, she has 2 children, she doesn't smoke or she doesn't use alcohol. Her allergies, her medications, nothing significant there that we can pick up on. He did do a physical exam as part of this. And we can see if we look through here, her HEENT, normal, meaning her head shape is normal. Her eyes, tympanic membranes, everything's fine there. Her neck, there's no thyromegaly or adenopathy. The lungs are clear. Her heart has normal sinus rhythm. Her breasts are without masses. Her abdomen is soft, non-tender. There's no enlargement there. He did a genitalia. This is a female. So this would not be done on a male. So this is something we have to think about in our coding process, that he actually did a female examination as well. And what he identified here is that her cervix and her uterus is absent. And he also did a vaginal pap smear. Okay. Neuro was intact. Her psychiatric was, no counseling was indicated. She's alert and oriented to person, place, and time. Her assessment is her headaches. That is a problem that was identified in this exam. He cannot determine where they're coming from, unknown etiology, what's causing them. So he's going to do a SID rate, going to check some blood. If that's normal, then they'll order a CT scan of her head. Other than that, the physical was normal. She'll come back in 10 days if she's going to have that head CT. Okay. So now we want to think about what are we coding here? And I'm just going to go over, I'm going to show you the walkthrough now. And we're going to look at our ICD-10 diagnosis codes first. I can pull them up here, or I'm going to walk through here. The first thing is that we have an examination, an annual exam, but we have abnormal findings because that headache is not normal. And he certainly is addressing it because he's doing blood work. And if that's normal, he's going to do a radiological exam. So we want to identify that this is an exam with abnormal findings. So that is our Z00.01. If we assigned Z00.00, then that would have been the annual exam, but it would have been with no abnormal findings. And that's not the case for this patient. We have a headache going on. So our appropriate first listed code is Z00.01 because that is why the patient's here. She's not here for the headache. She's here for her exam because the insurance is going to pay for it, and they probably require an annual exam, either through her insurance company or perhaps through her employment. So that's going to be the reason the patient's here. There is an instructional note at this code that tells us to identify the abnormal diagnosis. In this case, it's a headache, and that's all we know. We just know the patient has a headache. So it's R51.9. The next thing is that because this is a female, there was a gynecological exam done. There was no abnormal findings, but he did a gynecological exam. So that is going to be your Z01.419. And I'm going to pull up find the code, but I want to go over the codes first instead of going back and forth. The next thing is the pap smear. A pap smear is done to identify cancer, as well as other conditions. Primarily, it's done to identify malignancy. We want to identify the fact that he also did a pap smear. He did a screening for malignant neoplasm. Z12.72. Now, if we look at this code, Z12.72, we have an instructional note that tells us to use additional code note to identify the acquired absence of uterus. Also, we have an instructional note to code to identify any family history of malignant neoplasm. So we've got to pick up the fact that her cervix and uterus is been removed. We saw that in the exam. And her mother had colon cancer. He identified that, so we've got to pick this up because we have an instructional note here that tells us to identify these two if applicable, and they were. Okay, next we've got to think about what CPT codes are we going to assign. All right, so I'm going to move over here and I'm going to show you. We have two. We have two codes to assign. We're going to assign this 99396. That's for our periodic comprehensive preventive medicine. And it's for an established patient. This is why the patient came in. It was for an exam, preventive medicine exam. And if I believe it looks like the majority, I think everyone got this 99396. What we don't have to assign is the pap smear, because in the 99396, comprehensive identifies all the tests that are done on a male and female. Okay. But we do have to recognize that we have a separate E&M code here. And we've got to look at our number of problems, because not only did we have the exam, but because we have the headache, qualifies it for an evaluation and management. So our problem is a headache. It's acute, it's uncomplicated. There may be a CT order depending on the blood work, whether it's normal or not. That's a low. We have the SED rate ordered. but it's just not enough to get us out of the minimal, the straightforward. And then, of course, the risks are minimal. There's no prescription drug management. You know, we always look for that to try to capture that moderate there, but there's nothing to give us a risk, anything other than the 99212. You cannot use the vaginal pap smear because it is considered part of the preventive medicine. Okay. So we have our 99396 and our 99212. Now we know that when we have a CPT code and an E&M code, we've got to have a modifier. So we're going to put this modifier on our E&M because it's only applicable to the evaluation and management for the physician office. Let me see if I couldn't pull up that. Is there anything before do I need to pull up anything for you to look at and find a code? Let me ask that first.
No, just I have a question. Will that be? Yeah. All right. So concerning the abnormal finding, the reason for my confusion there was, you know, the headache was not detected during the examination. She had it in the morning before she came to the hospital. So all along, I thought that we only choose with abnormal finding when that particular symptom or sickness or diagnosis was detected during examination. I don't know if.
Okay, and a preventive medicine is your annual exam. I want to make sure I answer your question, Eugenia. So if I don't.
Yeah, so my question is, you know, she came in with the headache already. So I thought that we will only choose the with abnormal finding if it was detected during the examination and not something that is already existing.
Okay. Let me try to explain this. She is here. She is strictly here for this.
Okay.
Her insurance company, for whatever reason, has sent her for her annual exam. That's what it is.
Okay.
All right. In this annual exam, she complains of this headache. And the physician is concerned about it enough to order blood work and possibly a CT. So the fact that she had it before is irrelevant here.
Okay.
It's because he's treating it. He's addressing it.
Okay.
And he's treating it with blood work to be ordered.
Okay.
So even though she's had it, it's not part of that preventive exam. It's totally separate. Yeah. Does that help?
Yeah. So I've now learned that it's not necessarily something that you identify during the examination. That's
exactly. It's not she's here for her preventive medicine visit, yes, but this headache is something that's been identified that needs attention outside of the normal preventive medicine.
All right.
That's an annual exam that your workplaces, your insurance companies may send you for, and it's going to be it's going to cover the patient's visit. And the fact that the headache was identified is additional information obtained during the exam. That is outside. It's not just for the preventive medicine.
Okay.
Does that help?
Yeah, it helps.
Okay. Blessing, you have a question?
Yes, I just want to confirm this. Just because the physician did a pap smear,
Yes.
that gives the encounter for tumor or like for colon malignant
Yes.
malignant disease?
Yes. That will be your code when a patient comes in for a pap smear and they're coming in for their physical exam, or if they're coming in with complaints of maybe abdominal pain or pelvic pain, and the physician does a pap smear. A pap smear is considered to rule out a malignancy. Let's pull up that code. Well, I didn't mean to take everything away. Let's pull it up. Okay, so what we've got here, this is a screening, it's a testing for disease or diseases, precursors in asymptomatic individuals so that early detection and treatment can be provided for those who test positive for the disease. Now, if we read on down here, we can see that our additional code that was back up here is we're going to also identify, this is where we came in with the absence of the uterus. This is a vaginal pap smear status post hysterectomy for a non-malignant condition. It's to identify malignant neoplasm of the vagina. So we don't have a history of any type of malignancy. He's actually screening to make sure that the patient does not have any type of malignancy that would be obvious in the results of a pap smear.
Okay, thank you.
You're welcome. Because if you go back and we look at this patient's here for a preventive medicine, that is a standard code, a standard diagnosis, a standard requirement for insurance companies. The patient may just desire to come in for preventive medicine. Okay, so we've got to capture everything done in our ICD-10 codes. And in the ICD-10, our Z codes don't capture screening for malignant neoplasm. That code of Z00.01 is the preventive medicine visit. But we also want to capture the diagnosis that the patient was screened with a vaginal pap smear for malignant neoplasm. Does that help?
Yes.
Okay.
Thank you.
Yeah, good. You're welcome. There's a lot in this. So this is a good one to go over and review and to think about and make notes, because you will see these in the office setting.